All right, everyone. Thank you for joining this webinar today. We hope you're staying safe and healthy right now. I know this is a crazy time. The webinar we are doing today is going to be Prevention and Protection Against COVID-19 and Influenza. My name is Katie Bruno. I'm the Marketing Supervisor at Hill & Marks. And today we want to just let you guys know that Hill & Marks is going to continue to be a resource for you and a support for you throughout this pandemic. This presentation is going to be some general information on COVID-19, prevention and protection methods from it occurring at your facility, keeping yourself safe. We're also going to be highlighting featured products to combat this virus. And we're fortunate enough to also have Sara Boerenko, Director of Public Health at Montgomery County, who is going to be offering her insight and expertise throughout this presentation. But we're very excited because she's also going to have a Q&A at the end of this for you guys to ask any questions that you may have. She'll also give an update on the county and kind of what they're seeing on their end throughout this pandemic, and she'll be happy to answer all of your questions. So throughout this presentation, if anything pops up that you guys want to ask her or would like to have her answer, please write them down, store it in your memory, and then kind of fire it off at the end when we have the Q&A section. We hope that you guys will mute yourselves until the end, just so that we don't get that kickback noise that feeds when sometimes that happens with webinars. So we are going to be muting you until the end for the Q&A, where you guys can kind of fire off questions. We are recording this webinar, so we will be sending it to you and distributing the presentation to you after the conclusion of this presentation. So with that being said, let's kind of get into this presentation and give you guys some education and insight on COVID-19 and how you can prevent and protect yourself from this. So let's get started. Okay, so the presenters today are going to be Sara Boerenko, Director of Public Health at Montgomery County, and myself, Katie Bruno, Marketing Supervisor. So Sara, if you're on, can you please kind of just give a quick description about yourself and kind of take off right now?
Sure. My name is Sara Boerenko. As Katie said, I'm the Director of Public Health for Montgomery County. I also oversee mental health services here, and we have been really at the forefront in working to get a lot of things out into the community. So I'm really, really glad that Hill & Marks is one of the first businesses to reach out to us and ask us to speak to customers and folks that they work with, because this is a group that we have not to this point had the privilege of working with. So thank you.
Thank you, Sara, for being here. We're super grateful to you and the county for all that you're doing to educate the community on this. So we're really grateful for all the hard work you're putting in. This is a pandemic, and we're really grateful for everything you guys are doing. So thank you to that. And then I'm the Marketing Supervisor at Hill & Marks. So I am responsible for communicating company information to the public, creating content that's relevant for marketing campaigns, and increasing brand awareness. So these are the two people that are going to be presenting today. And again, Sara's going to have a Q&A at the end of this presentation. So if you have any questions throughout the presentation, please just store them in your memory, write them down, and then she'll be happy to answer. All right, so let's move forward. So here's what you're going to learn throughout this presentation. You're going to know what you need to know about the coronavirus disease, aka COVID-19. You're going to learn prevention and protection methods, featured products to combat the virus, Hill & Marks' action plan, and then a Q&A with a public health expert of Montgomery County, Sara. All right, so what is coronavirus and SARS-CoV-2? Coronaviruses are a large family of viruses that cause illnesses ranging from the common cold to more severe diseases such as Middle East respiratory syndrome and severe acute respiratory syndrome. Coronaviruses are zoonotic, meaning that they are transmitted between animals and people. Several known coronaviruses are circulating in animals that have not yet infected humans. SARS-CoV-2 is the novel coronavirus that causes coronavirus disease, COVID-19. So SARS-CoV-2 is the virus that is going around. If you get infected with the virus, you can get the coronavirus disease, COVID-19. COVID-19 is a new strain that was discovered in 2019 and has not yet been previously identified in humans. And this information is from the World Health Organization. So how does the COVID-19 spread? Person to person is how it is spread primarily. So if you have close contact with an infected person within 6 feet, you could have a chance of contracting this virus. What happens is respiratory droplets produced is when an infected person coughs or sneezes. Those droplets then land in the mouths or noses of people nearby or inhaled through their lungs. It is possible a person can get COVID-19 by touching a contaminated surface or object and then touching their own mouth, nose, or eyes, but this is not thought to be the main way the virus spreads. However, it is imperative that you still avoid touching your face with unwashed hands, and you are frequently washing your hands and disinfecting as much as possible. The virus that causes COVID-19 spreads easily within the community, so this is known as community spread. Community spread means people have been infected with the virus in an area, including some who are not sure how or when and where they became infected. This is kind of why we're in a quarantine right now and while we're practicing social distancing, because we want to make sure that the community and people who are at high risk for this infection, we're trying to flatten the curve. We don't want to continue to spread this disease because it does spread easily. So that's why we are trying to prevent community spread by isolating and quarantining. So let's get to know what some of the symptoms that you may have. Reported illnesses may range from severe illness and death for confirmed COVID-19 cases, and this is also a virus that affects the respiratory system. So they range from mild to severe, and in the worst case scenario, it's death. So the symptoms may appear 2 to 14 days after exposure. Mild cases, you're going to see symptoms like fever, cough, shortness of breath. Severe cases, you're going to have severe respiratory issues, pneumonia, kidney failure, and the worst case scenario, death. Are you higher risk? So higher risk is going to be older adults, especially older adults with serious chronic medical conditions, including heart disease, diabetes, lung disease. If you are sick, you should be staying home exempt to get medical care. Stay in touch with your doctor. But however, you should call ahead. As I'm sure you are aware, healthcare facilities are inundated with cases right now, and they're working at the front lines to make sure that everyone is getting taken care of. So it's important to call your doctor ahead of time before showing up, unless it is an emergency. Avoid public transportation. Stay away from others, so home isolation. So this is if you are feeling sick, whether you have the flu or it's coronavirus. It's important to isolate yourself in your own home, away from your family who may be healthy. That means that you should be staying in your bedroom while your family is in the living room. Clean your hands often. Avoid sharing personal household items. So if you're feeling ill, don't share cups and drinks and spoons and forks. You want to avoid doing that to make sure that you're isolating yourself and stopping the spread. Clean high-touch surfaces every day. So that means doorknobs. Clean your phone every day. You wouldn't believe how many germs are on your phone. Disinfect your food service areas. Make sure that you are cleaning doorknobs and all of that in high-touch areas to prevent the spread of this if you are sick. And then, of course, monitor your symptoms. So check your fever. Make sure that you are doing a wellness check. Are you feeling worse? Are you feeling better? How is it going? Those are some of the symptoms that you guys should be aware of for confirmed cases of COVID-19. So they do range from mild to severe. And then we have some information if you're higher risk and what to do if you are sick. So now that we've given you guys some background information on COVID-19 and the virus, we're going to go into steps that you can take to protect and prevent COVID-19 from happening at your facility. So how to protect yourself. This is extremely important. Currently, there is no vaccine to prevent COVID-19. The best way to avoid being exposed to this illness is to avoid being exposed to this illness. So that means you need to clean your hands often. Wash your hands with soap and water for at least 20 seconds. Common practice is to sing happy birthday twice in your head to make sure that you're giving yourself a thorough wash. We also have a fun social graphic for other songs to sing with catchy choruses. So sing the chorus of Landslide when you're washing your hands by Fleetwood Mac. You can sing Jolene by Dolly Parton. Have fun with it, but make sure that you're giving yourself a 20-second thorough wash with soap and water. If you do not have soap and water available, it's important to use hand sanitizer with 60% alcohol. Avoid touching your eyes, nose, or mouth. Avoid close contact. So avoid contact with people who are sick. Practice social distancing. Social distancing is a distance of 6 feet and reducing gatherings up to less than 60 people. This is important for high-risk people. Like we said, we want to flatten the curve. This disease spreads easily, this virus spreads easily, so we need to make sure that people who are high risk are not being exposed and it's not continuing to spread. So make sure you're practicing social distancing and isolating yourself at the time, especially if you're sick. Cover your coughs and sneezes. So cover your mouth and your nose with tissue or cough inside of your elbow. And immediately wash your hands with soap and water for 20 seconds. Stay home if you are sick. Stay home if you are sick, exempt to medical care. And again, if you do need to see a doctor, try to call ahead, stay in touch with them, and make sure that you're taking their advice. Clean and disinfect. Clean and disinfect frequently touched surfaces daily and use EPA-registered products to do so. So these are some ways to protect yourself. Clean your hands often, avoid close contact, cover your coughs and sneezes, stay home if you are sick, and clean and disinfect. Okay, so we want to invest in essential supplies. Now, I'm not sure if you guys are aware of this, but this is extremely important. Avoid hand dryers at all costs. Hand dryers increase the spread of viruses and bacteria. Not only that, but there's a slower drying time. They leave your hands dirtier, and germs can remain in the air around a dryer for around 15 minutes. So hand dryers are spreading the cause of viruses and bacteria. So it's important to make the switch to a paper towel dispenser, especially a touch-free dispensing system. Paper towels are the hygiene queen. So you're going to want to invest in touch-free dispensing system, and that includes soap and water. You also want to have a paper towel dispenser that is touch-free. This decreases the spread of germs. You want to invest in waste baskets to make sure that you can dispose of cleaning products or tissues that you've sneezed into, but make sure that you have waste baskets available. You want to have EPA-registered disinfecting wipes confirmed against fighting COVID-19. So we also want to recommend the Clorox T360 electrostatic sprayer. The T360 uses a wraparound technology for superior coverage. How do you know if a product is EPA registered against coronavirus causing COVID-19? Check your manufacturer's website and review the EPA website using your EPA registration number. We have an example of a picture right here. In red, it has EPA register number there. That's where you would check to make sure that it's registered against COVID-19. EPA means product is eligible and considered effective against COVID-19. So you want to look at that registration number, fill it out, see if it is effective against the specific virus. So these are going to be the essential supplies that you're going to want to have at your facility, your office, to make sure that you are preventing and protecting your staff from COVID-19. Cleaning protocols. So obviously you need to review, update, or develop a cleaning protocol. This is imperative to make sure that your staff, especially your custodial staff, knows what they are doing as far as the cleaning plan against this type of pandemic. So what you're going to want to do is you're going to use disinfectant that is EPA registered against SARS-CoV-2, that's the virus that causes COVID-19, and follow the instruction that we said in the previous one to view. You want to make sure your custodial staff is properly trained. Follow instructions on cleaning chemical labels. Disinfectant dwell times. Now, I don't want to gloss over dwell times because this is extremely important. A dwell time is you want to follow the instructions on the back of the label to see how long you need to let the disinfectant stay on the surface. At least 2 to 3 minutes to make sure it's the most effective. And also, you want to make sure that you cleaned that surface before you disinfected. Where, when, and with what. Your team should know where they're cleaning, when they're cleaning, with what. We recommend having a checklist for your staff to make sure that they are doing everything right, that things aren't being missed, and that they're following protocol. Your staff should properly understand the difference between cleaning, sanitizing, and disinfecting. So cleaning removes germs from surfaces or objects, and it works by using soap or detergent and water to physically remove germs. This process lowers the numbers and risk of spreading infection. Now, disinfecting. Disinfecting works by using chemicals to kill germs on surfaces. This process does not clean dirty surfaces or remove germs, but it kills the germs on the surface after cleaning. So again, it's imperative that you clean before you disinfect. Sanitize. Sanitizing lowers the numbers of germs, bacteria, fungi, or surfaces to a safe level. So you want to make sure that your staff is aware of the differences and the process and the protocol for cleaning. Where you should clean. So you want to clean and disinfect all frequently touched surfaces daily. That means doorknobs, that means elevator buttons. You should be cleaning your cell phones. You should be cleaning high-touch food service areas. making sure that places where people are consistently frequenting and touching is being cleaned and disinfected. This is extremely important. Again, we want to reiterate, you need to remove and clean soil before disinfecting, or the disinfection won't be effective. You want to disinfect from high to low areas, and you want to disinfect last after routine tidying. So after you empty the trash and vacuum, that's when you want to disinfect. When you're vacuuming, particles might be flying into the air and landing on surfaces. You want to clean that and then disinfect. Again, follow dwell times based on product labels. This is important. We have a picture here where you can see to sanitize, allowed to remain wet for 30 seconds. To disinfect, allowed to remain wet for 10 minutes. Wash hands after use. You want to make sure that you are following the labels and dwell times based on this information and instruction to make sure that you are getting the most effective clean. It's also important to consider a one-step disinfectant versus a disinfectant that requires a pre-cleaning setup. So again, Clorox C360 would be a good option for that. All right, so here's some featured products and resources available. Hill & Marks has put together an information hub for coronavirus. So it's going to be hillandmarks.com/COVID-19. That's going to be the link. And when we send this presentation out to you, you'll be able to click and it'll directly take you there. This hub is being updated daily with critical information. We'll be having flyers, for instance, that you can download that'll be perfect for your facility. We have relevant blog posts from Hill & Marks. We have blog posts shared on there from Clorox. We have blog posts shared on there from sanitary maintenance. We're consistently updating to make sure that you are getting the most relevant information regarding this COVID-19. We also have videos on how-tos and product spotlights. We have a hand washing how-to. We have a video on the Clorox C360. We also have a video on the Georgia Pacific and Motion touchless paper towel dispenser. So we have all these how-to videos that you can learn more information about products and get educated on what you will need for your facility. We also are having weekly webinars similar to this one for target segments. So this webinar is a presentation on general information. Next week, we'll be partnering with Clorox to do long-term care facilities. We'll be having a webinar with based on education segment. We'll also be having one on food service. Some of the flyers that you'll be able to download at this information hub is going to be the Hill & Marks product and solutions flyer. On this flyer, we have soap and detergent, soap and dispensing systems from Gojo. We have the Georgia Pacific and Motion paper towel dispenser, Clorox 4-in-1 disinfectant. We have microfiber cleaning cloths and a disposable mop from Rubbermaid. We are consistently updating these flyers to make sure that you have the best product to combat this virus. For those who are restaurant owners on this webinar today, we have carryout options and solutions for you throughout this dine-in shutdown. So we have the solutions you need for your takeout business to take off. And you can download these flyers at this information hub as well. We have a Clorox Pro flyer that has EPA registered solutions available for you. We also have a best practices flyer demonstrating the difference between cleaning, disinfecting, and sanitizing. And then we have a Hill & Marks hand washing poster that you can print and laminate at your facility to make sure that your staff knows that they must be washing their hands and here's the best practice. We also have resources available from the CDC. So they have educational materials on action that everyone can take to prevent the spread of illnesses. And then they also have posters on proper hand washing as well. So again, this information hub is being updated daily with product knowledge, with relevant blog posts on how to prevent and protect. We're having weekly webinars like this one to educate our customers on specific best practices, best cleaning practices. We have videos that you can watch that are how-tos. So these are some of the featured products and resources available that Hill & Marks is going to be continuing to provide you during this time. It is evolving consistently, so we're constantly updating it and giving critical information. Again, the information hub is at hillandmarks.com/COVID-19. What is Hill & Marks' action plan? So Hill & Marks is focused on serving our customers while keeping our employees safe during the outbreak. Employee welfare is extremely important to us. So basically, we are conducting a daily disinfection program at our facility. That means we are having the Clorox C360 twice a week at our facility. The employees who are working on site, which is not that many, have disinfectant wipes that they can use at their desk. They're also sitting at least 6 feet away from each other. We're educating employees on prevention methods, including frequent hand washing. We're equipping our drivers with sanitizing kits to utilize after each delivery. And in some cases, we're preventing the drivers from coming in contact with another person, but making sure our customers are still getting their deliveries. We're accommodating our staff by setting up work from home stations wherever possible. I am currently working remote right now. If you hear my dog barking in the background, I'm sorry. We are limiting contact in healthcare facilities at this time, but we're also familiarizing our drivers with healthcare organizations' response plans. We're still servicing this industry and giving them everything that they need possible, but we are having a healthy response plan to make sure that our employees are safe. And we're establishing preferred methods of communication with our sales reps and customers. So supply chain. So during this outbreak, we have seen a significant increase in purchases of hand sanitizer and disinfectants. Given our 30-year relationship with manufacturers, we've been able to expedite product deliveries and get ETAs to our customers. However, the demand has exceeded the supply chain capabilities. Our manufacturers have increased production, and we're continuing to work diligently to get you guys updated information. And also our purchasing team, hats off to them, are working tirelessly to make sure that we can procure alternative products and vendors to substitute typically purchased products that are out of stock, but still have EPA claims. So we're continuing to make sure that we have the product to provide you guys, but wanted you to be aware of the supply chain as well. We're serving our loyal customers first. So while we have many organizations and companies reaching out to us, we are prioritizing our current customers. And we're sharing expertise. We're doing this through these educational webinars. We're doing it by having an information center based on COVID-19 to make sure that you guys are accurately getting updated information about this disease, this virus, and how you can best prevent it from affecting your facility and the products that you need to make sure your facility is still operating. And Helen Marks is confident in our future. We believe that we can adapt to this pandemic and be able to provide you all with insight and resources and product that you need to keep your facility safe during this time. So Helen Marks has an action plan. We are continuing to face this head on and making sure that we can, keep our employees safe, but also provide support, resources, and product to our customers. So this is going to be an extremely important part of this presentation. A pandemic is a very stressful time, and it can be upsetting to some people to have to experience this type of situation. It's a crazy time, and it's not something we're all used to. So we wanted to be able to provide you guys with some support to help yourself during this time and kind of manage your anxiety and keep calm and wash your hands. So here's some things that you can do to support yourself during this time to remain calm. So take breaks from watching, reading, or listening to news stories. Repeated updates about a pandemic can be upsetting, and the news cycle is 24 hours, specifically with social media. So it's hard to take a break and to separate yourself from this news. Yes, it's extremely important to be aware of what's going on, but it doesn't have to be a 24-hour news cycle. So make sure you're taking healthy breaks away from the news so that you are not inundated with negativity. We also want you to take care of your body. So take deep breaths. It's important to get a full breath, breathe from your stomach, and make sure that you are relaxing yourself and your nervous system. Stretch in the morning, give your body some movement. Meditating is always helpful. There's a ton of meditation apps online that you can download from your phone. Headspace is one of them. Just breathing for 2 minutes, just focusing your mind and centering yourself is important during this time, this chaotic experience. It's important to eat healthy, well-balanced meals. So maybe if you guys are home, working from home, and you're quarantined, it's a good time to learn how to cook. Making sure you're getting proper nutrients into your body and eating healthily will help you feel better throughout this time. But also support your local businesses and order takeout as well, because they're seeing a decrease in business with having dine-in shut down. So it's important to have a healthy, balanced meal, but also support local business. Exercise, so doing 50 jumping jacks, doing some sit-ups and push-ups, any type of exercise to get those endorphins flowing, to get the blood moving during this time will help you feel better. And it's important to get enough sleep. Just make sure you're getting enough rest and really focusing on your mental health and managing your anxiety through this time, it's as important as being aware of what products and stuff you need to combat it. So make sure you're taking care of yourself as well. And the CDC has a managing stress resource that you can visit at any time. And so we would like to reiterate, keep calm and wash your hands, because Helen Marks is taking a proactive approach to making sure that we are keeping you guys updated and safe throughout this. So with that, it's going to be Q&A time with Sara from the Montgomery County. She is the Public and Mental Health Director. And if you guys have any questions, I'm going to unmute you all. So if you guys have some questions, reach out to her and kind of ask her.
Hi.
Does anyone have any questions for Sara?
Can you confirm the life of the virus on the surface?
Some people, some of the studies that we are seeing, it can live, for 9 minutes, and then others saying that the virus is living up to 3, 4, 5 days. So I think there's a lot of really conflicting reports. I can tell you one of the things my staff and I did here, sort of like a science experiment. We have a black light that shows germs. So what we did was we saliva on a desk, and we let it dry, and we black lighted it, and then we sprayed it with water and bleach, and then wiped it, and the water and bleach killed the saliva. So it's not a scientific experiment. We just, for our own peace of mind, wanted to kind of see what we're dealing with as far as acting and cleaning.
Does anyone else have any questions? Feel free to ask. Hold on.
How long do you think before somebody has an answer to that question of how long it can live on the surface?
That's a really good question. I think that's more of a CDC question. I know the CDC and the NIH are working tirelessly to figure out, where this virus comes from and what it's made out of and what are the different components. So I've just been monitoring the CDC website, and I think it's important to just look at the CDC when we're talking about this, or the NIH, because, this information's coming out from different media outlets and social outlets.
Okay, I'll look there.
You guys can also enter some messages in the chat as well. Sara, do you want to give an update for them on the county and kind of how the proactive approach you guys are taking and what it looks like on your end?
Absolutely. So one of the things we're doing here at Montgomery County is we are really trying to educate our community and the public about prevention measures and taking preventative measures with spreading this virus. So as most of you have probably seen via media and the Department of Health, in the county we are at 2 positive confirmed cases of COVID-19. And when we received word that we had our first case, what we did was we very quickly enacted our state of emergency and started looking at where the outbreak was, or the first confirmed case was, and how to really take a look at shutting down and restricting areas around where patient 0 was located. So for us, we really are looking at how do we prevent the spread of getting out opportunities. And I think working with our county executive and some of our local businesses to get people to understand the importance of social isolation and social distancing at this point is how we in the county are going to work hard to prevent a huge number of outbreaks. We're also working with our local hospitals and healthcare facilities to get people to call us and triage some of those patients over the phone so that our hospitals and our urgent cares and primary care centers not as inundated with patients who are just looking to get tested when they have no signs, no symptoms, and no exposure risks and facts. Again, we have very, very much been pushing since actually the beginning of November, hand washing, cleaning, and disinfecting. My staff and I are very much proponents of prevention versus treatment. So we all know that it's easier to prevent a problem than to treat a problem. So we work with our community members on things like lead and what are cleaning products that we use to help folks who may be remodeling or renovating their homes with preventing lead exposure. We work with the flu. So for us with COVID-19 and getting the message out of prevention and cleaning measures and disinfecting and taking that one step further with just encompassing another virus, for us, this is just seamless. We have been fielding calls from the community, from businesses, service providers, housing developments on, suggestions on what to do of limiting visitors and really taking a look at our community from a more proactive approach.
Also received a question from Pamela Grant. Thanks for asking a question. She asked, beyond products used, what's recommended for wiping surfaces, paper towels, fiber wipes? We do recommend microfiber wipes. They remove 99% of microbes, and we have some from Rubbermaid. We have a few in stock that we have a few at our facility that we utilize, and microfiber wipes are good. Paper towels are also effective. But if you have any product questions, we encourage you to call your sales rep after this and kind of ask them what they think and let them give you your product expertise. But yes, microfiber wipes would be a good option as well. Any other questions? All right, so we're getting some questions here. What would the dwell time for 10% be for a 10% bleach solution? I would have to check the back of the label to make sure. They usually have instructions on that. I don't want to give a general answer and have it be incorrect, but I would make sure that you check the back of the label to see the dwell times for that. But again, usually at least 2 to 3 minutes for dwell time. Jason Packer asked what you do if you've been exposed to a person with coronavirus. So if you've been exposed to a person with coronavirus, it's important to get tested and isolate yourself. So quarantine yourself, depending on the severity of the symptoms. You should make sure that you're at home. Again, some of these symptoms are mild. They're not as severe, so you want to make sure you're isolating yourself, taking care of yourself if you're sick, monitoring your symptoms. If they increase, then you should be heading to the doctor.
One of the things that we are really pushing here at Public Health is that if you have been exposed to somebody who actually did in fact test positive to COVID-19, your Public Health Department, one of our jobs is to get a contact list. So when we receive a positive confirmatory test that a patient has tested positive for COVID-19, we are working with that patient or a contact list of every person they have been in contact with during their incubation period, depending on when their symptoms started. And then what we are doing is calling every person on that list and saying, you had a possible exposure to somebody with COVID-19. Could you answer a few questions for us? Or do you have a fever? Do you have a cough? Are you sick? We do a health screening with every single person that has come into contact with a patient who is tested positive for COVID-19. And then the local health department makes the determination as to where that testing site would be. Because if we're just saying, you know, you came into contact with somebody who is tested positive, go get yourself tested, that's what we're trying to avoid. We don't want people just showing up to the ER or the urgent care or their primary care provider actually at the health department. And it's not just Montgomery County, it's all health departments are working to help people who have a possible exposure set up that testing. That we don't want more than 10 people at one location at a time, because we know that is what is spreading people. But we want to be able to stagger those appointments for testing so that people are not congregating and all rushing to a testing site or location all at the same time. And what is happening now is in counties, not all places have kits. In order to prevent all these going to one place at one time, the county is working with providers to set up specific testing locations that we will be sending people to, so that there's not 50 people at one time showing up, and B, we have the capacity to really monitor the folks who are being tested and who are sick.
Sure, Jason has another question. So he wants to know, what if someone in the company has been diagnosed with coronavirus, possibly exposing others in the building?
So if somebody in your company has been tested, so how it works here is the minute somebody is tested for COVID-19, they are automatically placed on a 14-day mandatory home quarantine. So if they were at your building today, but they tested positive, they went and got their test tomorrow, they would be quarantined starting March 20th for 14 days. So then when we got those results back that the person was positive, we would take a look at their contact list and talk to the folks who had a direct contact or exposure with that person, and then we would be in charge of monitoring them. So there's a lot of moving parts here. It's not as cut and dry as somebody would be in your building running around positive for COVID-19. Once you are tested, and I think that's what we're finding a lot in our community, is people are thinking that it's like the flu. You just go to your doctor and you get tested for the flu and then you go about your normal business. No, this law is very different. Once you say to me, I want you to test me for COVID-19, I am literally putting you on a mandatory court-ordered home 14-day quarantine. So a lot of people don't like that. So they're really saying, oh, okay, well, no, I don't have symptoms. Wasn't exposed to anybody. It sort of changes the dynamic of things, because when people start realizing that the minute they get tested, they're being put on a mandatory 14-day home quarantine, they're not necessarily willing to do that, knowing that they don't meet the risk factors and the criteria for the symptomology.
All right. Anyone have any other questions for Sara? Sara, Chris would like to know, where can they find locations for testing in Delaware County?
That's a really good question. You'd have to call the Delaware County Public Health Director. To be honest with you, and this is going to sound really ignorant, I don't even know where Delaware County is, but your health department is the one you're contacting for their testing protocols and procedures.
Okay. We also got another question from AJ. With some people not showing symptoms for the virus, if they're possibly being exposed, why is more testing not being provided?
We don't have control over the number of test kits that are being produced. The test kits are coming directly from the CDC, and unfortunately, with the demand for kits, again, I don't know this for certain, but my guess is they can't keep up with the demand of the number of kits that are needed. So I know here in Montgomery County we have just over 47,000 residents. So for us, for me to go to the CDC and ask them for 47,000 kits, if every county across the nation does that, it's just impossible. And you guys know, at Hill and Marks, when you're in a business where it's supply and demand, the more demand you have, it depletes your supply, and sometimes it's really hard in a timely manner to replenish that supply. But I do know that the government and the president has released some guidance that they are going to be looking at other manufacturing the vials for the testing.
Also, Christy, I saw your question, and I will be sure to email you with the answer for that at the conclusion of this presentation. We're still open for questions if anyone has any. Sara, Public Health Director at Montgomery County. It looks like there's not many more questions, Sara. So thank you so much for your time and for all of your expertise and information. It was super informative.
Thank you, Katie. And I just want to thank you guys. Everything that Hill and Marks has done for us has been really wonderful. And, the fact that you even did this as a business for your customers, it speaks volumes for you, because a lot of agencies aren't doing this. So I want to thank you for doing this for your customers and our community.
Thank you, Sara. We appreciate you and the county so much for all that you're doing, and we're extremely grateful for you all. So thank you very, very much, and we appreciate you joining this presentation today, and we couldn't be more grateful. So thanks for all that you're doing.
Absolutely. Thank you, guys, and everyone be well.
All right, everyone. So actually, Jason answered Christy's question. So Christy, if you're still on, microfiber cloths should be washed after disinfecting your room. They should be color-coded by bathroom versus non-bathroom, and they should be washed and air-dried. All right, so everyone, thank you so much for joining this webinar today. We hope that you got information and education on COVID-19. We hope that Sara's expertise kind of gave you guys some insight into what it is from the county. If you need any more info, we encourage you to contact your sales rep or visit hillandmarks.com/COVID-19. We have recorded this webinar, and we will be sending the presentation out to those who signed up. We're very grateful again for you guys to come to join us today, and we have more webinars coming in the next 2 weeks for specific target segments. So continue to join and check out our website and make sure that you're up to date on all the information. So everyone, please stay safe and stay healthy, and know that Hill and Marks is here to support you. We are a resource for you, and we are working tirelessly to make sure that you have everything that you need. So thank you all so much, and have a great day and stay safe.